Good day, good evening, good afternoon, and good night, and welcome to another exciting episode of Realz Tennis Podcast. Today we won't be talking about Harry Potter stuff, though you people who are fans of ours, you should be listening to the Black Cauldron. Shame on you for those numbers that I'm seeing, but I know you're secretly listening anyway. But today we're going to have a regular tennis podcast. Andreen is back with us today. She is not doing the required reading for the Harry Potter podcast, so we had to sub her out. But she's here today, and we're going to have a wonderful time. And we have a guest, but I'm going to save the guest for later. First, to introduce my co-hostesses with the mostesses. I am nothing without these ladies. We have Andreen from Solely Tennis Travels. How are you?
Hello.
You need to become closer, Andreen. I know you're feeling yourself. You can't see her, but she's like waving her blonde hair around. She's just like feeling herself. Like,
not even, no.
Oh, come on. You're extra fancy these days. It's okay.
Since I'm quarantined with my sister and she's a makeup artist, she gets to play with me now because none of her friends can come close. So yes, that's what you're getting. You're getting her testing out her hair technique and makeup techniques. So
that might sound like she's complaining, but you should see her in the DM. She's feeling herself. We get all the exclusive pictures. And she's travel ready. Unfortunately, she can't travel. She looks like she's ready to see the world, but
no more.
She has to be at home. And I don't know when, it might just be Andreen. That's it.
No, you know what? Apparently we could start soon. Did you see American Airlines is saying, hey, we're going to fill up our planes again. So traveling can happen whenever.
And then they were like, forget social distancing, forget our protocol, just get on the bus. Okay, all right. We would see in a month's time how those numbers kind of look. And we have Janina from Foreign Ohio. How are you doing, Janina?
I'm well. I'm excited about this because I feel like I'm about to learn a lot.
Okay. But what we really want to know is your kid are still alive.
He's alive.
Okay.
He stayed up late with Dad last night, so he's sleeping. So hopefully we won't hear him.
He's gonna come and be like, "Mom, what's to eat? What's down for lunch?" Mm-hmm. And myself, real. But today, I'm not important. We have an exciting guest on with us today. We have Dr. Adia Benton, an associate professor. She has a PhD in social anthropology from Harvard University, 2009, and she's currently I believe is an associate professor, if I'm not mistaken, because these things are very technical in the academic world. She is, yes, an associate professor at Northwestern University in anthropology. She has been a visiting professor at Harvard Medical School. She started Brown. She started Oberlin. She's a fellow at University of Minnesota. She has degrees from Brown University, Emory University, and Harvard University. A PhD in medical anthropology. Ma'am, welcome to the podcast. And I must say, you are an overachiever, and we love it. But I mean, you're making us, usually we're just happy to get a couple of letters behind our last name, instead of the usual period. But you have an alphabet behind it, and we love it. Welcome to our tennis podcast, Realz Tennis Podcast, Dr. Benton. How are you?
I'm fine. Thank you for inviting me.
Yes. So, you have all of these degrees and whatnot, but the most important question when we're going to figure out whether or not you can hang with us is, are you a Rafa fan? Are you a Federer fan? Or are you a Nole fan?
I think I can choose Rafa on this one.
Oh, 2 Rafa fans in a row. I don't know what we're doing.
In the immortal words of Whitney Houston, it's not all right, but it's okay.
Okay. I mean, my second choice would have to be Federer because me and Djokovic we're not doing that. We're not doing that this week.
I agree. I mean, with all your degrees, though, I mean, some of his most rabid fans have degrees, have PhDs and whatnot.
Some people like robots. So
that's true.
We can't pick our kin sometimes.
Okay, so you can hang with us, ma'am. You can hang with us. It's very tricky, I mean, because if you were an only fan, that would mean that hell freezes over, and we're We're doomed now. We're doomed.
Still holding out for 2020. We're still keeping hope alive that 2020 rolls as maybe it's better. Maybe. I don't know.
I don't like that look on your face, Dr. Benton. I don't like that look. So, and you're the expert here, okay? We are usually the pessimists, in the world, but if you have that look on your face, I don't know. So we invited you here to talk tennis, because it's a tennis podcast, but to mainly, pick your brain and, to educate us, because we are in the midst of a global pandemic in COVID-19. But you, on the other hand, you have expertise and you've written your first book. I didn't mention that. She is an author. She has written the book published in 2015, HIV Exceptionalism, Development Through Disease in Sierra Leone. I know you're currently working on the second book project dealing with the Ebola virus, and you love global public health. Let me just say personally, I'm geeking out because you're here, because you have ticked all of the boxes that I'm interested in personally and academically. And we are now in the midst of a brand new global pandemic, something I don't think the world has ever seen before, in terms of usually when we've had pandemics in the past, they've been isolated in places, and usually they have been in the global south and, in like quote unquote Africa. The diseases of pandemic proportion, the Spanish flu, etc., they have been isolated in the global north, in the developed countries, or they have been spoken about in the dark ages of like the Black Plague, etc. So the world is basically the developed world is seeing and dealing with a situation that they thought they're almost immune to, dealing with it. And interestingly enough, to some respect, the global south is doing somewhat better with this disease than the global north. So Dr. Benton, the floor is yours, basically.
Oh my goodness, you covered so much though. So, I mean, I don't know what you really want to know yet, but so I think one of the troubles that we're having in this state is, obviously we're not doing a very good job. And a lot of that has to do, so it has to do with kind of a longer term issue. And that longer term issue is, the way that we've talked about it amongst ourselves, the people who work in public health and anthropologists who study health and how health is governed, is we have kind of ripped away or eviscerated our public health system. And the way it's organized is, there's sort of a national agency that handles this stuff. And that sort of evolved over a course of 50 years during the Cold War and everything else. But then every state has a health department. Every major city should have like a robust health department, and counties and so on. And so what we're looking at right now is our premier institution in Atlanta is not one that we can look to for advice, for guidance, or at least, and not even reliable data. And then we have our states, which, we're looking to that agency to help provide guidance. And so there were quite a few states that I think were late to the charge, except the ones that kind of anticipated the disease. So the ones that saw themselves as hubs from China. So actually, I'm based in Chicago, and one of the earliest known cases was here in January. And they kind of locked that down really quickly, but they didn't do all of the due diligence that's required. Like, how do you contact trace at this? How do you make sure that everyone's tested, blah, blah, blah. So we basically have failed in a bunch of different areas. The first is coordination of information, coordination of response. We failed in terms of setting up the response with respect to like contact tracing and testing. And I'm sure you've heard all of this stuff. Like, you've heard about all of these failures over the past few months, so I won't rehash them.
Oh, no, it's fine, because we've hardly heard them from Black people. So we're excited to have Black people.
But also what's important for us too, though, is to understand like what are kind of like the bread and butter responses to a pandemic, so that the general public can understand it, right?
Right. And well, I think one of the big challenges that we face here, though, is it's new. Like, it's a brand new disease. And so we were doing a lot of our work, like, thinking about what disease it's like. So is it like the flu? Is it like other coronaviruses like MERS, which actually also had which is also a coronavirus, and which also not devastated a region, but definitely kind of got people really thinking about new diseases and what their impacts can be globally. So, so the countries that have done really well were South Korea, Japan, even China. You know, for all of the shit talking about China, there was definitely, so they made a lot of really smart moves very early on, and I think part of it can be attributed to the fact that they'd been the places where all of these sort of new viruses are emerging, or new to human viruses are emerging. So what they did was they said, okay, you know, let's do a regional shutdown. Let's really try to find out what this is. Let's try to figure out how it's transmitted. Let's try to figure out how long, what the symptoms are. Let's, you know, so they kind of had to do the basic work of like epidemiology. What is this disease like? How long are people infectious for? How does it spread? And how would one prevent it, right? And so that sort of started the move. Once they were able to sequence it, they were able to come up with a good test, and they set up their system around developing that knowledge, but also making sure that people didn't die. Now, the other question is like, how long did they know? What did they know? And then how quickly did that information filter up to the World Health Organization, which is essentially the global clearinghouse for I would say infectious disease data. They also do a bunch of other things, and they're not very well funded, and they don't have a lot of people. And so that sort of explains why they were kind of like also scrambling to figure out what the best approach was, what's going on, how do we mobilize globally to be able to try to do this. Countries like the United States, many countries in Europe pay into that system and are the biggest donors, but they also are less beholden to the rules of that system.
Yeah.
And that's sort of true across the board when it comes to UN stuff. That's sort of right. I mean, it's always like, oh, we have these sustainable development goals that we have to, you know, it's going to be like about climate change, it's going to be about poverty alleviation, it's going to be this. The US signs on to these things, but then they don't count themselves as people who need to measure
or to be held accountable, right?
Exactly. We're paying you. It's basically being paid to get out of our face. Stay out of my face, okay? Let me do me. You know what I mean? I'm paying to be the exception.
Yeah, and we are the experts. Like we develop the metrics.
Yep.
We develop, and so that's kind of what I actually study, which is like, how do these powerful institutions establish an agenda, and then how do they to what extent do they direct their resources toward it, and who benefits? And it's very rarely the people that are named as beneficiaries, right? So that's sort of the system that I look at, but I look at it in places where those systems have quite a lot of power. So I work in Sierra Leone. I used to work in Nigeria, occasionally go to East Africa and Southeast Asia to think about these questions. So the COVID thing is interesting because it's, like I said, it's a new disease. People are still learning about it. That doesn't mean that we don't have models to follow. We have tuberculosis models, which is also droplet infection and also kills a ton of people every year, but it does have an effective treatment. We have SARS and MERS, and China's health system is basically built to respond to SARS. So it kind of had its reckoning back in 2003 about what happens if another one comes up, a new disease comes up that's circulated by air and that moves through elite networks, which is essentially what COVID did, right? Like our earliest cases, at least Chicago, Northsiders who were working in China, who had business in China, they come back, their partners are infected, then their kids go to their schools on the North Side, and then blah, blah, blah. And then, but those same people also take the L from the airport home. So everybody gets, so it's sort of, that's how this thing spreads. It spreads at least in these sort of global elite networks and sort of filtered out into what I would say more marginal or general population. It's true even in the African setting, or especially in the African setting. So you haven't seen a lot of cases in sub-Saharan Africa yet. And my sense is that it's because these earlier cases were people who were circulating, moving to Europe. So I think the first case in Mozambique was the mayor of Maputo had gone to the Commonwealth meeting in England, sat with Prince, whichever Prince had it, and it kind of started that thing. This guy has to go to a wedding, and then everything sort of spreads that way. That's how, yeah.
The same thing in the Caribbean as well, where the cases that mostly were people traveling, and the islands that had a much more busy international hub, they saw larger numbers, particularly those if they're still connected to directly, as in Martinique and Guadeloupe, connected to France. They had high numbers because travel back and forth is relatively easy and so common.
Exactly. So basically, what you're saying is that theoretically, I'm the kind of person that would have moved this thing around because I was doing my solely tennis traveling.
Yeah,
very much.
Absolutely. And I was saying I was in Switzerland in December and got pretty sick. And I was like, I went to all of these restaurants, and this, Geneva is a very international city. Pretty much everybody in that restaurant had been somewhere else. And including me. And so I was thinking, I wonder if that sickness was just me being jet lagged, or was it me having some kind of respiratory infection related to all of the people that I came in contact with. I gave a talk in a room that maybe seated 40 or 50 people. And so, I'm supposed to be in Baku next week for Euro 2020. Did not make it. I'm not going to make it because Azerbaijan is closed.
But to your point though, I think what's noteworthy about this idea of kind of the elite spread is that we've so quickly abandoned just even the understanding of that and begun to sort of blame the people who currently have COVID.
Oh, absolutely. And I mean, but that's also, so that's sort of like the sort of bread and butter discussion of by medical historians and anthropologists who study medicine, health, and epidemics is there's always a layer of blame.
Yep.
Like blame and accountability are central. And if it's not, the government, right, it's the people who are perceived to be the risk group, right? Mm-hmm. Or the people who have suddenly become risky, and it's not the elites anymore. It's Black and brown people.
I can't even. So many times I'm walking in the street and see a white person without a mask on. As soon as they see me wearing a mask, they decide to put their hand in their pocket, which has all been dirty from COVID in the air, whatever, and put a mask. Just put the mask up to their face, and I'm just like, boo, you are the risk factor right now, not me. But
that's interesting. That happens. That happens. I noticed that. And I wonder if there's a kind of, you're right, maybe there's an they internalize that we are the risk group. So when I'm walking, I'll notice people at a distance will not have their mask, and then they'll come closer to me and they'll quickly put it up. And I'm going to be generous and say, okay, well, you're thinking about me now. But no, I'm sure.
And this happened as soon as the first week when the information came out that when people were pushing for the numbers and saying, clearly because we know America, because one of the reasons why people ask for race numbers is because we know this is America. This is a public health pandemic. We don't have free health care in America. And we know that Black and brown people are marginalized in the healthcare industry, just getting any kind of care. So they would have been like, supposedly, like, we would be the people pushing the chopping block. Everyone was talking about age factor. Mm-hmm. And as America noticed, one thing that immediately was just like, this was not attacking older people. This was attacking working age people, right, particularly in New York. And as soon as that first information, when the numbers came out, oh my God, this is disproportionately affecting Black and brown people. And I was shocked that the news took this up, because generally the news don't like to look at race and ethnicity numbers because right, they could put this on anything, right? Education, they could do this with travel, money, economic. They shy away from this bit of the story. But they put this up big and bold. And that very first week, I noticed people started doing that to me. This man was walking about, I'm in Brooklyn Heights. He put up a mask on his face. And I was just like, bro, like, you didn't care about walking around all the other places like that. I was just like, okay. You do whatever feels comfortable for you. But, that's not how science works. But, okay, you do you. I think it'd be...
One second, Realz. What do you think is fascinating about it, Dr.?
Well, there's a part of me that can see that happening, because that, when Asian Americans or people of Asian descent were suddenly, this is about Asia, this movement of disease is about Asia, people were very much targeted. Asian people were being targeted. or visually appearing, Asian people. There's this other piece though that I'm thinking about, because I run outside, and I actually had my tennis lesson before this, which I have lots to say about. But
you're in the right place.
I know, it's so funny. And so I was thinking about how when I see people on the street, and I'm running, and I tend to not run with a mask, if I see them like 30, 40 feet away, that's when I start to make my way. I try to avoid people because I'm like, if I happen to have it, I don't want anybody to get sick, or vice versa. I don't want anybody to feel the need to like hold their breath or put on their mask or whatever. But I also have moments where I put my mask, like, you know what I'm saying? So mostly because I am trying to be generous about other people. So I don't know even if it's either other people and trying to prevent the spread, or preventing the spread between us, but also other people just sort of modeling the right behavior. Right.
Well, when you talk about, so that's important. You talk about modeling the right behavior. Can you talk about your experience of dealing with pandemics around the globe, as opposed to what's happening here when we have an administration who isn't leading by example? We have a president who will not wear a mask. What effect does that have on how everybody is behaving?
Yes. I mean, we're lucky that there are a lot of people who think he's an idiot. So that helps. That helps. But there's that piece, that's sort of modeling piece, but it's all the other stuff, right? So he's very much about, he's never really been good about good information, right? He's definitely one who likes
full sentences is too much. Full sentences is limit.
He tried, right? It's like he sort of, confusion is a part of his ruling strategy. And overwhelming people with information and winging it is a part of his thing. He doesn't like to be thoughtful, and and so his entire approach, Pence's approach, the head of the CDC's approach, the Surgeon General's approach, all of these people who've been brought together as a part of this task force have done a terrible job communicating very basic health messages. And so we need a national strategy, yes, but we also need regional, state, county, and city ones as well. And I think, again, if I didn't live in Chicago, I wouldn't feel this as acutely, because I know that there are different levels of governance that should produce results. So, for example, the city of Chicago has a pretty robust health department compared to like other cities. It's probably even more robust than our state's health department. Now, this is the same administration that could send out an emergency alert to lock us in the city, or keep us from getting on public transportation during a protest, but can't put out an emergency alert telling us where to get tested, telling us what to do if we get sick, telling us how we should access services should we need to be isolated. All of these things that are supposedly in place, but cannot be accessed because of poor leadership. And I'm talking about at the city level. So imagine that at the sort of federal scale. So what I was going to say about this is a pandemic. It's the first in a while. HIV was one. We also had new disease, people not knowing how to characterize the risk, and people knowing people not knowing how to avoid or harm or minimize harm at first. But that information evolved. People began to know more and communicate more, and we also pushed. I say we, even though I'm way too young to have been one of the people who pushed for changes in regulatory frameworks and stuff like that. But that's why we have the ability to speed things through regulatory processes, like the vaccines that we're looking at right now. That's why we have the possibility of drugs that can go from being tested in March to being possibly used as the therapy at the end of the year. So anyway, during Ebola in West Africa, and as you probably know, there there's another Ebola outbreak in Congo, one that just ended and one that's starting up. What we know from those outbreaks is that early community engagement is important. So, and really being able to try to communicate risk, but also setting up, making sure that you've set up your system such that people are able to access it and people want to access it very early on. So one of the things that I fault our various levels of government for, I think Washington State is very different. I think California is slightly different. Washington State is sort of, I'd say, the paragon for this, because they actually tried to develop a test very early.
Yep.
They were testing people who were, I guess, suspected flu patients, but couldn't actually diagnose with flu. And so they actually they already had stuff on the ground that allowed them to be able to sort of expand their ability to trace contacts, to test people, all of that very early on. Of course, they were still in lockdown for months, just like the rest of us. But they had all of these other things in place. The people who made it difficult for them to do that stuff, those are the people who ended up causing trouble. So again, community engagement.
I mean, the people with guns and the ineffective.
Yeah. So the federal government actually was butting heads with
with them
state over the tests that they were creating, over the mechanisms that they were using, because they were not approved by the federally. So this actually caused some trouble. Okay, so community engagement, very important. It's not that the West Africans that I'm talking about did it right the first time, but the lesson was learned.
Yeah.
And one of the things that also worked really well was when communities got the information and folks were going door to door and saying things like, here are things you need to know. You need to wash your hands. Here's some chlorine. If somebody gets sick, you do not want to touch them. You do not want to touch any of the things that they touch. Here are some gloves. So there's a kind of, these are the facts, but these are the things that you do with those facts. So we now have an emergency number. You can call it. And when you call it, someone should come to your place, pick the person up, assess them for possible Ebola. That person will then be isolated until they get their test done, and so on and so forth. And so there's a system in place, and that system needed to be explained to people so that they would, again, want to go, but also felt safe doing so.
Isn't it true? Isn't it true that a lot of that system was put in place from people that the United States sent? They helped implement all of these things. So I'm wondering, why is it so difficult for us to bring that back home?
Right. So some of it was, yeah, for sure. And the US and the UK, to some extent France. I always side-eye France. But so yes, the emergency operations centers were things that absolutely look like what happens in the CDC when there's a all hands on deck kind of notice. So it may very well be, I actually haven't talked to my friends at the CDC in a while, but it very well may be that they have an emergency operations center right now. But
it's not being utilized.
or it's being used, but it may not be, maybe they're all having to do it by Zoom.
Yeah. Oh, yeah.
Right. So maybe they're having to do. So there are a bunch of things. So I happen to know that's the CDC people who are experts feel like they are being held back.
Yeah.
So I definitely got that sense. There are other. So yes, I mean, yes, you're right. Many of the models that are being used throughout the world are ones that are created in Geneva, Atlanta, London. They are. But I actually also want to say that a lot of the things that worked in places like Liberia and Sierra Leone were local initiatives.
Okay.
So that's a two-pronged thing. Yes, the technical dimensions need to be there. You do need hundreds of thousands of people who will actively be tracing contacts. You need places where someone can isolate should they need to be able to isolate. You need to be able, I mean, South Korea just made a ton of masks for people. Singapore just made a ton of masks for people and handed them out very early on. Mm-hmm. They said, and if you're sick, this is the place you need to go to. If you don't have an extra room in your house, here is the place. And I will tell you something, Chicago actually has a similar thing, but nobody knows about it.
That's sad.
So nobody knows. So it sounds to me, though, Doctor, what you're saying is that there are systems that are currently in place in the United States to take advantage of all the lessons that we have sadly had to learn, but we just don't have a unified message about it. It doesn't flow from the top all the way down. Because one of the things I think about, you say Washington State and California, and to some extent, some other states are probably a little bit doing as best as they can. But it feels like on some level that they can't go it alone, right? It feels like now as I look at the sort of let's reopen, they set parameters for reopening, didn't meet the parameters, and then still kept trying to do it, because it's like this, it's almost like you feel like you're working against the grain because there isn't a central message that says you have to do this.
Right. I think that's what it is there's no coordination. Yeah. And one of the other things, it's funny too to think about this, during the Ebola outbreak in the Democratic Republic of Congo, the one in the Kivu region, in the eastern part of the country, a woman I know she's an expert in coordination, which I bet you didn't even know that those existed, but they are, which means that they basically get all of the agencies working in a place to do all the work together. And it's, you're like, wait a second, that sounds really basic, but it's not for some reason. And we don't have that, but so they do this in war zones. They do this in humanitarian emergency operations. They do this even in the development sector. They sit down and have meetings and try to make sure that everyone's on the same page. And that's technically what that group that Pence is head of is supposed to be doing. It's supposed to be coordinating with state health departments. It's supposed to be coordinating with regional. And so there are some of these states that actually form regional coalitions so they could make those decisions. Yeah. So Connecticut, New Jersey, New York were like, yeah, let's talk about the fact that people move between our states and actually try to think about what that looks like. That's why Massachusetts said, hey, let's really develop a robust contact tracing network that will allow us to really get down and find out who is sick, who needs help, and link them up with services and make sure that they're tested and make sure that they're cared for. And I think that's one of the things that we also should have learned and continue to learn from these epidemics elsewhere, which is coordination is key, but also starting from a position of care. Yeah. Really thinking about meeting people where they are and understanding what their fears are about, the intervention apparatus, but also their fears about the disease, their fears about accessing the services and interacting with systems that haven't been serving them well. So I think that's sort of the big picture. And that's something I definitely would say was a lesson learned from, say, Sierra Leone, which is, did people really want to be under state surveillance? Yeah. Did they feel like restrictions on their movements, if that they could balance their need to, pay the bills, their need to provide for their families with this restricted mobility? And then what would the benefits in the end? Is it worth it to send a loved one to a hospital where they're going to die and you won't see them again as a result of like all of the restrictions on who can come to the hospital and whether you can touch the body or see the person buried?
We can't put ourselves in this situation. Like, they almost have to reimagine a whole new apparatus that accounted for lack of a better word, white people and white sensibilities, that to put the United States and Europe under these kind of conditions where you're going to have contact tracing, where you're going to have to basically speak to people where they are and, put austerity measures and, also you have this quarantine and lockdown. It's like the audacity, and God forbid, wearing a mask is seen as basically putting people in ball and chain. So, I mean, it all seemed to have a sort of because for me, I'm just like, it's science though. It's talking about keeping the people alive.
Global health comes from international health, which comes from tropical medicine, which is essentially, I mean, some people will dispute this, but this is my shtick. I say this to all my students. And tropical medicine is colonial medicine.
Yes,
so any kind of many of the devices or many of the techniques or technologies, I'm calling them technologies, the things that we are used to doing in public health are reflected in that colonial heritage, which does think of space as risky and does think of certain geographies. So and let's put it even more simply. Yes, places where Black people live are disease and pose a threat to white bodies and white people by extension. So that is sort of the essence of the tropical medicine, which is how do we make the environment hospitable to white settlement? And so, that meant, well, do we have to live at higher elevation so that the mosquitoes don't give us malaria and typhoid? What are we going to do? Or yellow fever?
You were speaking on tropical medicine and the whole how medicine works, but it's interesting because in the Caribbean, persons studying medicine, Caribbean nationals who were studying medicine, they were studying tropical medicine, and it was almost impossible for them to even go to developed countries to practice medicine, even though we were talking about the bodies. And it's only recently where students who didn't get into the American students who didn't get into the top schools here in United States can study in medical schools in the islands and around the world. Because in the past, they will just basically, boo, that's not going to happen. You can go there, but guess what? You won't work in a hospital anywhere in the United States. So it's rather interesting to see that that this is a thing that's been going back since colonialism, well, since Christopher Columbus, we should say. These sort of ideas and how it plays out on such a mundane level as healthcare of the just ordinary citizen, that this drives policy, that policies, in fact, were built around racist and colonial principles. And for us to even move forward into the future and even be better, we have to uproot these systems which have long been embedded in our head, because Andreen pointed out, this is almost psychologically frightening to think, like, how do we, and we have a global pandemic which is affecting everyone. How are we going to move forward in this space, really?
I mean, I hope we are going to be able to. I mean, I was also thinking about the fact, one thing I also wanted to point out is contact tracing. It's funny to see it as people talking about it as a mainstream thing, but it's also like this interesting little bread and butter thing. If you have so for example, if you have one of these notifiable conditions, like, a sexually transmitted infection, like gonorrhea, there's partner notification.
Yeah.
That has been in place. That has always been in place. Yeah.
Exactly. Like, people know, like, there's a thing. People know about that. Yeah, you can call. They will give you you have to give them a list, and they call people. So we have a protocol. We have experience. This is not a lot of this is new stuff.
But then again, that contact tracing that we know about, it's for marginalized community, right? This is for people who, particularly, it'd be the LGBTQI community or sex workers, they would probably be thinking about. We don't think of contact tracing for the normative, Anglo-Saxon white male, who is in the power structure. Like, can you imagine a CEO saying that he has to give his contact information to the people he's come into contact with because of COVID-19? He's going to be like, that is business information.
It's a funny thing, being subject to public health surveillance or surveillance by the state, I think is, yes, very uneven. And I was just thinking about the guy who had tuberculosis. Remember him it was years and years ago. He had what they call extra drug resistance tuberculosis.
So I remember that. It had to be like locked down. People had to make sure he would do
that. Well, he was on his honeymoon or whatever. He went to South Africa. He went to Italy. He did all the stuff. And it ended up causing this huge thing, because people were like, did he get, they were trying to trace the whole seating arrangement on the plane, like who would have come in contact with him, because it's notoriously hard to treat. And so people were really concerned about it, but that kind of person not only raises international alarms because of the person's sort of elite status, but it also creates a fundamental challenging of these systems that are very much about sort of about surveillance and about following people and about getting their information. So people actually have to trust that that information is going to not be used against them in various ways. I was listening to an interview with the Icelandic group that was doing contact tracing there. I don't know if anyone heard that story, but they talked to this guy. He basically helped to create this app. Iceland has a few 100,000 people, but they trust that their government isn't going to like try to sell their name or use their information for something nefarious. I think that's one piece. But and the person who created the app said that. He said the app is not the thing. It's a tool that we're using to help people remember where they were on the day that they were sick. We only want the information so that we can help, so that we can make sure that that person is adequately cared for. And again, they led with care. They led with rapport. They led with how do we interact with or engage with this person such that they are able to keep themselves safe, but also make sure that their families and that their neighbors are safe. And so again, that's what we're always butting up against, is the extent to which people are going to be willing to engage with these systems and recognize them as systems of care and not ones of marginalization or stigmatization or any of those things that I think are built in.
And I think that that's a fair point. And I'm, I was listening to you speak at another, in another talk, and you talked about sort of the three kind of models that are kind of floating out there, right? You've got the Chinese model and you've got the Taiwanese, South Korea, which is kind of, people are like, oh my God, those are democratic countries too. Why couldn't we? And then you've probably got something like what the US and the UK tried to do. and Sweden too, right? Which is kind of like, let's just wait and see what happens maybe. But one of the points that I was curious about was this idea of in the isolation question, about sort of how the Taiwanese sort of approach it as like, well, let's isolate some people. And then with the Chinese, it's like, let's close down a region maybe, and then potentially maybe expand that. But with the US, we went to sort of this absolutist model right away. That was the first step.
Yes.
And so once you start there, it feels really difficult to go anywhere else, right?
Absolutely.
And those places also provided social services. They had a social service apparatus in place so that you could stay in place. They didn't say, well, you got to go out for groceries. You got to go out if you're an essential worker. You got to go outside.
Well, I'm kind of curious though about kind of the trajectory given the US's system, given the kind of given the sort of limitations based on the fact that there isn't a really functioning public health system in the US, or a robust one. Would it what could have been a model that we could have imagined, given sort of the dynamics that's playing out now, people's sort of ideas of liberty and all of that?
Right. And so I think that's the thing is okay. So I would even say our public health system is fragmented.
Yeah.
In the sense that there are some places that actually are better equipped than others.
Yep.
Because of how they've prioritized. That said, we could always be spending more money on public health and less money on the police, for example. So now we're kind of so we are. So I would, if the way that I imagined it is that if we had started with a regional approach that looked like the Chinese approach. And so what if Washington, Oregon, California, New York, New Jersey, I mean, and actually Chicago. I am actually thinking in terms of the hubs that had those earlier cases. So what if those actually were the places that we initially started? So one of the things we can't do is we're going to shut everything down indefinitely.
Yeah.
Like, I think that was the big problem. And I think you're right. So what we say in this case is, okay, we're actually going to shut down for 2 weeks. or 3, whatever it is.
Mm-hmm.
But the understanding is in that 2 to 3 weeks, every single person, we will have had something happen where we have tested, we have screened, we have developed a system. Like, yes, how do we, is there an isolation? Are there hotels that we could fund? Whatever. Can we give people certificates and blah, blah, blah? Or we say, we're gonna be closed for 2 weeks. You need to go get your food. If you don't have food, here is your gift certificate, whatever. And then you're done. 2 weeks, everybody's down. You do all of the stuff that you have to do. You actually do all of the setting up the contact tracing, setting up the isolation unit, setting up a financial sort of social safety net, and social safety net for everyone. Mm-hmm. That's what you do first. Then when you handle those major areas, you try to roll out and make sure that your data and testing mechanisms are up and running for those other states, because you do know that nursing homes, hospitals, prisons, jails are going to be your problem. Mm-hmm. Because these are the places where they're spreading in China. But these are also places where we know the confinement is happening. So we learned about person-to-person spread somewhere in January, right? That's when the evidence was happening. It's not going to be just animal to person. That's not what's happening here. When China shut everything down, that was the message. Hi, people are spreading this person to person. Health workers are getting sick. So that's what I would have done, a regional rollout of those measures that allowed for development of actual systems to address the questions of testing, contact tracing, isolation, and the sort of social safety net. Then after it's piloted in those regional hubs, you're in that time where you're setting that up, you're also rolling out the same mechanism in places that you know are going to be high risk. Mm-hmm. Or again, nursing homes, prisons, jails, whatever. Then you start to think about schools. Even though they were like, oh, they knew that kids could get sick. They knew that they just didn't know whether kids were driving the epidemic. Mm-hmm. They didn't know if schools were sites that were accelerating or amplifying transmission. So now that you know that children are being infected, you know that and that households are your other kind of like vectors or whatever of infection, you screen schools. Anyone in your house been feeling like, has anyone, whatever, and you start that. Go to places that you know people are, that people absolutely access, that people have an opportunity for transfer, and you start working from there. We did it all wrong. And
we did nothing, basically.
Well, I mean,
we sent people home and did nothing.
And we actually did do some things, because I work in healthcare, but because people don't trust what you're going to do with that information, they lie. And I saw it every day from the beginning. We screened every patient. We had a list of questions. They were screened on the phone. They were screened when they were scheduling. They were screened when they came in the building, and they lied because they didn't. People, first of all, are selfish. So they want to come in and get the care that they think that they deserve, because they're better than everybody, and they're always the most important person, always. That's just how patients think. But they lied to the screeners, and then they go in and talk to the doctor, and boom, all of a sudden you have all of these symptoms. Then everybody's panicking because, of course, they weren't wearing the correct PPE because we don't have it. Mm-hmm. But we're trusting that people are telling us the truth about what their symptoms are. So they come in, they lie, then they get in a room with a physician and an assistant, and then they're sick. And then you've exposed all of those other people. So it goes back to what you were saying about trusting that you're going to do the right thing with the information. Because there were some spots where we were trying to do this early, but it just wasn't working because people just have this inherent lack of trust for the government and for authority.
I don't really know I think it depends on who you're working with, though, because I could see, like, if you think about who's doing the asking, like in many communities here in LA, you've got promotoros who are like trusted folks who have longstanding relationship with the community, and you can engage people in that task where there is trust. Right. And I think the assumption is like, yes, maybe you coming into a formal doctor's office is different. That's a big problem anyway. But I think you can work with mechanism where there's a higher degree of trust. Mm-hmm. And also in a school district too. I mean, depending on what's going to happen, you're more likely to tell a teacher something than you would maybe somebody else. So I think it's really about sort of engaging and being thoughtful about who can ask certain questions, who's likely to get a truthful answer, and activate some of those systems.
Right. I also think the question of trust isn't just about trusting institutions or individuals, but trusting that they will do something that aligns with what you think they should be doing.
Yeah.
And so what I do know about, I mean, I know this about the US, but I also know it about other places, is you're right. There have to be people. So I think one of the problems here too is the distinction between public health and healthcare. Mm-hmm. So the doctor's encounter, the clinical encounter, I think is even the next step. One of the things that we've been concerned about, there are quite a few people who I won't say will never have a clinical encounter around this disease. But there are a lot of people who there are going to be a bunch of people who will have to stay home. There are going to be a bunch of people who are going to, or who may experience minor symptoms or be spreading before they're experiencing anything. And so it really requires a system that addresses the information first, that mm-hmm. addresses the what do you do part of things if you were to experience this, and then what will happen should you have to encounter a clinical space, or should you encounter. And so one of the things that wasn't in place is that we didn't have all of the stuff in place to be able to say definitively, yes, when you get tested, we're gonna try to do something for you. We're gonna make sure.
And you know what? We are what, almost 6 months in, and we still can't answer those questions.
We don't. I'm shocked. I have a friend who works for the city, and she was like, and she's an official person working at the top levels, and she's like, I still don't know where the testing centers are.
Yeah.
Yeah.
We had to go, we went to a researcher who had been doing this, and he was like, yeah, my research assistants have been Googling and watching the news mm-hmm. and adding things to the list.
I did that yesterday.
Right.
So I had to get someone tested, and I had to Google because I didn't have the information that I should have to tell them what they needed to do.
Like a list. Imagine.
It doesn't exist.
And we can even pick it, you might even pick it up at the post office or a local store you go to. So in light of this, let's do a little transition. If we think about how tennis, let's move into our space that we love. If we think of tennis as the space where they took a decisive step, Indian Wells said absolutely, and now we are 3 months out, and we've had the Adria tour.
COVID.
First of all,
let's travel the Balkans.
I just want to make
play limbo.
I just want to say that Indian Wells and Indian Wells and Miami has come off looking with time. They have aged well to make them seem that they were brave. They weren't brave. They were getting shellacking on social media. And Miami waited to the very last minute. The only reason why Miami decided couldn't go on is because the idiot in chief said Europeans can't come here, and people had to skulk to get out because they were afraid that they would have been stuck in the United States.
And ironically, it was Novak Djokovic who led the charge on a flight out of here. So let it not be said that he's unaware of a risk. On some level. Let's start with what everybody's thinking about. The Adria tour. And there have been some defenses of it, which is this idea, which is one that we spent quite a lot of time talking about.
I'm sorry you can't see Dr.
I know. No, but I mean, like, so we could. So I'm gonna try to be reasonable. So let's say
I knew she would have been that person.
I
right?
know I'm gonna be the
I knew
person
it would
that's
have been
gonna
her.
try to be reasonable. But the thing is, okay, we've just spent a good chunk of time talking about general confusion, right? Confusion at the government level, what have you. That has been the rationale for why the Adria tour was allowed to go. Serbia was different. The Balkans was different. Could you disavow us all that, please? Could you help us understand what that rationale even means?
I'm still trying to figure it out. Like, it's like, how could they be protected? I mean, there's nothing. Yeah, I'm trying to figure that. I probably should have looked at the numbers for. I could look now, because there are. Let's look at their COVID numbers. What do they look like? Did you look?
I did. Look.
Their numbers were very modest, but the one thing that was noteworthy is that one day, 4,000 plus people were suddenly healed and better.
Right. And
because what happened was it was based on the fact that I think they were doing 2 negative tests initially. You had to have 2 negative tests to confirm that you were COVID free. And then mysteriously they shifted it in the middle that you had to have 1 negative test.
And what was happening is that an immunologist was there just like, what are y'all doing? There's something wrong with these numbers. And knowing the history of the Serbian government and how, well, not even the history of the Serbian government, almost every single government in lockstep did this thing where they were bobbing and weaving and pretending that this thing wasn't real. That, every single government, I'm almost sure, pretended in some capacity, whether to the people or to the general public or to the international world, that this disease wasn't so real, and the only thing you had to fear was fear itself. And I hate those words so much.
Oh my God! Do you know who just said that?
Oh God, who?
They said that.
No. The former New England Patriot just said that.
Tom
Brady.
Oh, Tom Brady. Oh God.
Jesus.
Tom Brady is literally the last person that I want to hear say anything about
science.
Anything. Because I
literally quoted that.
He was just like, that sounds really smart.
Yeah, I know. It's one of those things that really sounds smart, but to an English major, you're just like, what the fuck is this? It just makes no sense. Like, this is stupid. But I mean, so the Serbia had that issue. So there was already, I mean, to speak of general confusion, I wouldn't say that there was general confusion in Serbia. That the impression I was getting was that people recognized that in most places that people on the ground knew that the situation seemingly far worse than what the government was willing to admit publicly. That people knew this, and then experts were also saying this, because if you remember specifically when Nole was having an initial stage of the quarantine, Nole started to spout his anti-science, anti-vaccine situation. The Serbian health minister was just like, bro, no, you can't do this. Do not say this. This is not okay. I know he's a hero, but this is not kind of statement you should be saying publicly, and we sort of have to depart your ways. I think he was reprimanded. He got into some level of there was issue around this because Nole is a big deal in Serbia. I mean, I don't think people understand, like, he is a huge deal. There will be a monument of Nole in the town square in Belgrade Square.
It will have more personality than
that is true, but it is a thing.
I hope it has an RF logo.
Will we be marching to tear that monument down 100 years from now? That would be weird.
I'm sure people there would want to do that, but so in light of all of this thing happening, the Adria tour popped up. And I mean, look, I'm just gonna say this. I'm no Nole fan. I was pissed about the anti-vax situation. I hate anti-science people because they can't bring any proof for their anti-science-ness. But that's, a whole other conversation. But if you look at the pictures for the Adria tour, you can't tell whether it's 2020, 2017. You think we are in December, basically. Because you cannot imagine that this is 6 months into a global pandemic when basically no country, every country that reportedly in the beginning said we have a handle of this situation, are now scrambling in the back. Singapore, Beijing is about to go on the lockdown again. Like, no one has handled this situation I don't say like successfully. No one can put their hand up and say, yes, we've beat COVID-19. That T-shirt is not even printed in a box waiting to be sold anywhere. The marketing. So I was surprised that not only was I couldn't tell there was no social distancing in the crowd. I mean, these people went out of their way to rub onto each other. The only thing these people did not do, and I don't have any for me, is that they didn't have sex. They were rubbing on each other in basketball games.
That
I
you
know
don't know.
Exactly.
I mean,
so wait, it looks like you looked up some. Did you find Serbia's numbers?
I did.
Okay.
They're higher than I thought. I mean, they're higher than I thought, actually. And they're much higher than Croatia. So I guess what I'm wondering, I don't look at these numbers and think these are actually the numbers.
Yes. No one. Yeah.
But what is their reporting? So they have 14,000 confirmed cases, 12,000 recovered. That's actually impressive. And then 270 deaths. So that means this is counting this is at least weeks of. I'm still not sure how they.
Yeah, these numbers, because the modeling for the numbers are that you're gonna have a number like 14,000 confirmed cases. You're gonna have a 5% death rate of those numbers. You're gonna have about two-thirds of those numbers would be pending. You always have a pending category.
Right.
The recovery rate is never that high.
It's weird. It's like I'm surprised. There are like 2,000 people who are still sort of not accounted for, which is good because that means that those are people who are still sick, but it means that they haven't been
cleared.
Something is not right about how many they're confirming.
The recovery rate numbers are too high from all the other numbers I've seen. And also we have to bear in mind that every single country there have been questions surrounding their reported numbers.
Because they're probably not testing.
They're probably not testing, and also they're probably just not putting in numbers.
We all know the more you test.
And it's only the testing. It's only with testing that that COVID is actually real, right? COVID is only real if you have a test, right? That it miraculously appears when you test, according to our idiot in chief. That seems to be the implication. So the Adria tour went on. I mean, like, these people did everything to prove a point that they were back to, I don't know, August of this time. They went to a club. They don't even go to a club. These are not the French boys. I mean, had you been in Paris, I would have been like, okay, cool.
What are you trying?
So I have to ask the question though. So the way that I understood this tournament, so it is a tour. Yep. So they were supposed to go to
different countries,
Serbia, Croatia.
They went those places.
No,
they weren't allowed in. They weren't allowed in Montenegro because Montenegro thought something was a little funky with the numbers.
Right. Okay, that's what I thought. So they're supposed to hit all of the former Yugoslav republics. Yep. And I know that he has framed it as this is philanthropic because the people in the Balkans need harmony and tennis or something like that.
Positive energy and water bending.
I was like, he was born, when was he born? In the 90s? So he was born after the war. So I don't know, I went through this whole.
No. He was in the war. Remember, his biggest trick was that I was in swimming pool. So he was.
Oh.
Yeah.
It's part of the narrative.
I'm trying to do the math because I lose track. They all seem so young now that I can.
Right.
My brain doesn't compute.
But you know what? But I think to your point, it's a big part of the storytelling around who Novak is, his value,
right,
and his sort of like his status.
Yeah, and so this is sort of the thing that I'm trying to reckon with, which is how he's sort of saying, yeah, it's bad that people got sick, but keep in mind that this was a philanthropic an attempt to bring people together. But this is absolutely the opposite of what actually needs to be happening during a pandemic.
Yeah, that's the weird part of it.
Right. So it's sort of like what does he think is tearing us apart? Like we're all.
But notice he's saying that it is. I'm sorry, we got sick. There has been no reporting, no accounting, not even acknowledging of the fact that they created a cluster, and they literally interacted with children, with adults, with the crowd. They went to a club. I mean, a club functions with you literally breathing on each other. A club doesn't work any other way. That I can't hear you talk unless I'm literally in your face, right? Which means the particles, which are everything already, you know what I mean? They got off.
I was even wondering. So when I saw those club videos, I saw them doing the limbo. I saw them doing that stuff, and they were I guess they were in the VIP room. But I was like, what clubs are open for these people that will allow them? So there's like a whole list of things that went. You know what it was like a whole series of questions. It was the tournament itself, but the fact that yes, you're right. They went out of their way to violate every single principle, and they're moving. They're like going from country to country.
Exactly. They don't live in Serbia because Grigor went home, and I was just like, he's not on a magic carpet. He got on an airplane.
He traveled to 5 different countries. Like I looked at it. It was like he went to Vienna, then he went to Zagreb, and then he was in Belgrade. No, he didn't go to Belgrade. Was he in Belgrade? Because they did play in Serbia, right?
Mm-hmm.
Yeah, that's.
They canceled one of the Croatian ones.
No, they canceled the final in Belgrade.
The final one. They
final. No, it wasn't in Belgrade because he went to Belgrade, and when he refused the test initially. That was the other crazy thing. I felt fine. Even despite there were positive tests, he said, I felt fine. I'm not taking the test.
He did say that. I was talking about Dimitrov, though.
Oh, sorry.
So, I mean, in terms of his
travel schedule. Well, and I think this is the piece of it that I think is really challenging, is that I really keyed in on that, too, is that I felt the tour, regardless of whether it was sort of philanthropic in nature, the way that it played out was aggressively against all of the protocols. Like it was almost to the point where it felt too aggressive. It was like, we're going to touch, even though you say not to touch. We're actually not going to take pictures in mask. We're actually going to keep on moving. So it was like they looked at all the rules that were declared as rules to help protect people and checked a box.
Well, let's remember what we're dealing with.
Yeah.
Let's remember that Novak Djokovic thinks that he can play tennis through telekinesis. I mean, this man, it's not okay. He's not okay. But
I think it's not just him, though, right?
No, it's not. But he has the influence to bring all of these people into the circle. And, he seriously had the crowd stand up and say, let's take a moment and acknowledge those who have gotten sick with COVID-19. And now look where you are, bro.
This is the part of it, though, that for me is really troubling. Listen,
Novak let this happen?
Novak is who he is. But
right.
This is the tennis piece. This was there were organizations upon organizations that made this possible. And so that is stunning in and of itself, on its face. But then also, the individual players, yes, silliness, whatever. But the rules were known about how this virus transmits. So that's the confusion for me. It's just like how multiple countries kind of coordinated together
money
and let them just roll in and let them just roll in and out. Because when Nolis said that I am not taking the test, I felt fine. I was just like, he doesn't get to make that decision. Like, how?
Yeah, he should have been forced to take the test.
How could he not make? And I think then I guess PR decided to do this a bit where they're like, oh, he took a test and then he's negative, and then it became too audacious because Bona Chorich had it. So it was just like, at this point, two of you people like you hang with, like, you have to take a test. You will have to tell the public now, because they were willing to throw Dimitrov under the bus. And then we found out Sasha went back home and he was walking around the place. He said, I felt fine. I got tested negative. And I was just like, wow. And I left Chilich be the only responsible adult, was just like, I test negative, but I'm going to stay home. No, it was Viktor Troitsky. That was the problem. I think when Viktor Troitsky and his wife tested positive for it, and she's pregnant, he had no other choice but to take the test. Now, look, that situation is just insane. But I think, I mean, my disdain for these players is irrelevant. I am considering how the public, the government allowed this to happen, and all of those people, because no one mentioned contact tracing.
It's a
Everyone is like,
contact tracing nightmare.
everyone's talking about thoughts and prayers for Noli, and I'm just like, I don't care. He has money. A doctor would save his life in Serbia over Mrs. Blagojevich, who was at the event just to see a hero. They wouldn't. I mean, let's be honest here.
It's true, and that's essentially what happened with basketball. The in Oklahoma during that first COVID, right? The whole team got their tests when nobody else was getting their tests.
Utah Jazz players got Oklahoma tests.
That's right. They actually processed the maximum number of tests that they could process in that day to figure out who was actually sick or not. And interestingly, I believe they also had one of the tennis hotels for this Adria tour. They actually had testing available at the venue, the hotel, and literally Nolan was like, nah, I'm not going back to the hotel. And I was like, this is your opportunity. This is like amazing.
But that's the thing that was so sad. Like, because the interesting moment is, as soon as Dimitrov's test came out positive, you then saw all the players lined up.
Right.
And then they started performing as if they were working during COVID. So now everyone had a mask on. And that's when I thought to myself, well, then you were aggressively working to create another image. Because if now the ball's dropped, you suddenly realize you should be putting on masks. Cameras are showing you with masks. Do you know what I mean? So it just felt so that to me is such an interesting contrast, right? Because if it was humanitarian, and this is the part that I'm always like, Nole, you always miss the boat. You could have stood up and said, you know what? This is a real serious situation. This is a crisis point. I'm going to publicly go someplace and take a test. And then I'm going to come out and talk about what we did poorly and have it be a kind of teachable moment. But instead, it's this kind of like, I'm going to release a statement and then I'm going to hide away. And, it's just such a strange mixture.
It really is a missed opportunity. And, again, that's why I laughed about the philanthropy part and about the sort of war, whatever it is about the Balkans. But it needed to, there was, we all know.
Dr. Benton, feel free. This is the place.
All of you are saying all of the right things, which is what institutions made it possible.
Yeah.
For somebody for this tour to happen, but also to so aggressively flout the known guidelines, the basic ones.
Yeah.
Jamie Murray did a tournament at the same time,
just now. Yeah, it's just finishing up. Mm-hmm.
And it was very clear nobody is touching. They're getting their own balls. There's no crowd. It was to me very obvious that they took to heart, yes, we want to have this tournament and this is an important thing to do, but we're going to take all of the precautions we can possibly take to make sure that this is safe for the people involved. I don't understand. So the other thing I don't understand, in addition to all of the institutions that buttressed and supported this flagrant disregard for people's health and well-being, is who signs up for this thing. Most of these people are very concerned about their own bodies. They're
athletes, right?
They're athletes. So I'm trying to figure out who goes, oh, really? Yes, I would love to participate in this. So will there be, so how will you ensure that I will be safe?
Well, I think it's interesting you asked that question, because I think now you're getting a little bit of dribs and drabs about how all sorts of promises were made, and that in some sense, because obviously you're right, they're athletes. They should be asking these things, or at least their manager would. So then it sounds like when they got there, things sort of shifted a little bit and all the protocol kind of went out the door, or now it was like, oh, you don't have to do that, da da da. But then the other part of it too is that
Serbia's numbers, though. That's what he kept doing.
Yeah,
the same number that you're looking at. I was like, what? And
but also I think for the individual athlete, it was about being, and this is the part of it I think is challenging. It was being called by the number one player and feeling as if this was going to be an opportunity to be adjacent to power. and to be adjacent to somebody who has a lot of weight, right?
And you know what, Andreen? I think that also plays into, because I'm questioning parents who let their children volunteer.
Yep.
And I
They
think
had a kid's day.
but you know what? I think that's exactly what it was, because listen, we as parents often get our children involved in sports that we enjoy because we want to see them play something that we like, right? So these parents are most likely tennis fans, so they've got their kids involved in the local club with lessons, and we know that ultimately those are the children who become the ball kids. So mom and dad are like, ooh, my child can do this for Novak Djokovic, the number one player in the world. I mean, there are so many things to be questioned on so many levels, and no one's asking the questions, because right now, all of that's gone out of the window, and all we're concerned about is our number one player in the world going to make it through this, because now he's sick. So all of the people, and really the players, even though they're traveling, when they're not supposed to be, those everyday people who are volunteering for this tour are probably going to come into contact and have the opportunity to spread this virus far more than Novak. His bubble's going to be much smaller than the kid that's going to school and going to the playground and going to grandma's house, but we're not thinking about them.
Well, also, they're also not thinking about it in the same way, because I've seen in the defensives, oh, this is not a problem for us in Serbia. That's been quite a bit of the language.
Yeah.
You would think it's an individual fan, but it's also in the news coverage, is that, this is, and so that's one of the things I think is so interesting about this, Doctor, is like the sort of national view of a crisis and how that sort of directs people's attention. I mean,
Right.
We've been seeing it here, right? And so
we're not dealing with the facts.
To some degree, we can't, but to some degree, we can't even be too hypercritical of what happens in Serbia, because we're seeing it here. There is a sense of like, you need the top to communicate that this is a big deal. And they haven't.
Well, I mean, to a certain extent, I agree with you, Andreen, that, Americans and people in America should not be the one to talk. That is all true. But, I mean, we know that we have a certain state problem, certain places, etc. But this just seemed like a flagrant,
it was a PR campaign. Listen, let's just call it. I'll call it. It was a PR campaign for the president. It was a PR campaign for the government.
It is. I mean, they basically said, "Fuck you" to all of.
Think about if someone had done that here. Think about if an athlete had gone on and like was close friends with Trump and had done this whole tour, belying every one of the rules. We'd all look at that person in a strange way. We'd be like, "Why are you doing this? This feels weird."
But I mean, I think here people would have. I mean, I don't know. He would have been. That's what I say. Not only I think newspapers and the critical voice in Serbia failed, because I know immunologists was going on like, this is insane. This shouldn't have happened. Like, he was in shock looking at these pictures. But I think here, if anyone had attempted to do that, I think the pushback would have been severe, that they would have attempted to ban people from going in, that some health agency would have stepped in, would have been like, at the very least, social distance. Those crowds were packed in with each other. And this is not for me to beat up on Nole, because whatever, I don't care about Nole. I am concerned about Mrs. Blagojevich. All those people who are in the crowd, all those children who contacted, this is Serbia and Croatia. Those people live in multi-generational homes where grandma is in the house, grandma is close by. All those people are coming into contact with so many people, as Janina points out. And this can shut down our whole health system in 2 countries. Literally do the potential of this, how crazy this tour was. And guess what? Production isn't happening in most places of the world. We're not getting medical equipment out. And a lot of things COVID has basically stopped much of the resources that we need. And granted, in some places, like as we mentioned, like in America, we're not even producing masks and giving you masks. People have to pay $15 for 10 masks. And that's a good price just to be safe out in the world. And
so given all that, Dr. Benton, what's happened in Serbia, the U.S. Open is planning on moving forward. What do you think about that?
So I think those are big venues. And so it sounds like what they're trying to do is, they're trying to do it without crowd, right?
No crowd. And trying to do some sort of weird containment of the players to certain areas.
In hotels and...
But I'm asking.
But they're going to come from all over the world.
But that's
wait. Let her.
I think so. I mean, there are ways that they can deal with it. It's a lot of players. It's a lot of. I mean, I'm wondering how they make their money. But I guess is it through
TV?
Is it through subscription?
They make their money through TV. They make their money through the advertising and the subscription for the But so they're not going to do that. Right. So I think now the demand is to make the money through the TV, right? Because imagine having a live sport event. Right.
So I mean. It can. The thing about tournaments, though, is it can work, but the way it has to work is so they're coming from all over the world. That's the first piece. That means that they're going to have people come in early, which people tend to do to deal with the time zone stuff. They're going to have to immediately isolate them. They're going to have to test them, and then they're going to have to test them again and then they're going to have to make sure. And, I guess it works well for all of the players who are well supported to actually have them staying alone and basically not doing anything for them, basically only going to and from the venue.
But but how do we make sure? I mean, like the U.S. Open, Flushing Meadows is isolated. There is no hotel close by. They're not walking to a hotel. They have to get into a vehicle.
They do.
With a driver, which none of them will be able to drive.
Right.
And the other thing that I'm worrying about the European players, Europe might let you leave, but will Europe let you come back? This is United States of America. We are on a list. We cannot go to Europe. Americans cannot go to Europe for visit.
And Europe, and Europeans probably. I don't know if they never lifted. Did they ever really lift the ban
of a travel?
Yeah, for EU.
Within, I think, certain EU countries, there is certain the travel is opening up in next month, July.
Okay, so I think they're all banking on this, and I think they're all banking on this, and I think they're all banking on exceptions, right?
Yeah.
I hope that. I mean, how many people are coming from Azerbaijan, Armenia, and Georgia? Turkey. Those are going to be the hot spots. They already are the hot spots.
I think they're going to get special permissions. I think I think the USTA is banking on, I'm sure, a very high level relationship with somebody like in the Trump administration, right? To be able to, no, I mean, you would have to negotiate. This is what I mean when we ask about the question about Serbia. You have to negotiate lots of layers, and someone's banking on lots of really influential relationships for that to move forward.
I believe that is absolutely going to have to be. That's going to be part of the story. Yeah. Some people will. There are always going to be people who move very fluidly from country to country without any problem. This is the one time that not that being a U.S. passport holder is kind of scary. Like, oh my God, I can't go to Spain, or whatever. But the fact of the matter is for all of the restrictions I'm now facing as a U.S. citizen, I'm basic and normal and not important. Those people are going to get their visas. They're going to get their special dispensations. They're special. The issue for thinking about infection is absolutely going to be about testing, right? It's going to be about them being able to prove and show, not only upon their arrival in the United States, but also their return to wherever they're from, that they have tested negative.
My other issue. Sorry, go ahead.
Oh, God, this just gets complicated.
But here is where I think it gets even more complicated beyond the just mere logistics of moving them in a COVID-free zone within New York City in this humidity and madness and all of this bit, as New York itself is opening back up. But the other question is that, can you trust these players? They are irresponsible, and apparently none of them look at a science book. So when they do get here in this COVID-free zone, which we are banking, let's just assume that is a thing, that New York can create that. They're going to be doing all sort of things. I mean, like they've been to New York several times. They had their hotspots they like to go to.
They
And
will.
those hotspots are outside of the COVID-free zone.
And they're going to be open.
Yeah.
But they're also going to, but I would say most of those places will also still have some distancing guidelines. So, yeah, I mean, what I would say is if they're really careful, if they really care about their investments, they will force those people, every single player, to sign something.
I'm sure
they're gonna have them
something.
sign the Jeannie Bouchard contract.
Violated. I mean, see, that's the thing. This is business, right? This is labor. Yep. This is labor law. This is about
which the tourists notoriously are poor at.
Right.
So, and what happens when one person
and also you have to get this in, and also you have to get this thing in multiple languages because you cannot furnish this thing in English only. And that is
no speak English.
That is a science in and of itself. That is labor within itself. To literally get contracts to be legal, to be the same across the board in multiple languages. You're gonna have to require their lawyers to be present.
Yeah. Do all of that. I think the thing is you establish a disclaimer ahead of time, right?
Oh, go ahead and do that. Look.
And if you agree to participate, that disclaimer probably covers you, right? Do you think they get individual players, or do they just say, listen,
but that is just the liability. But that is just the liability factor, right? Whether they would be held accountable for the situation, but it doesn't account for the cluster that you will create, which is why, because their finances is their finances. But what is the problem here is that whether these people are bringing in the disease and continually spreading the disease.
So again, I think that's when they're going to have to have a real testing regimen, an absolute, and they're going to have to enforce, they have to say, look, you can't get sick here. Or, that's just not going to happen. I mean, again, I'm sort of also expecting, and I know I'm being naive, expecting that there's a substantial number of athletes who are going to say, I don't actually want to be sick with this thing either.
Yeah.
Yeah.
Because this will ruin the few chances that I have to play in France. I can't. The French Open is actually still supposed to be in September.
Yeah.
Yes.
Right. And so I want to be able to play that. Listen to me. I want to play the French Open.
Yeah.
I want to be able to, so I can see where that incentive. I mean, one of the things that I have noticed is that there are people who have been willing to change their behavior.
Yeah.
There are people who were otherwise complete assholes about this stuff, who are actually willing to go, okay, because I do care about myself and my family, maybe I'm going to not take the same level of have the same risks or engage in the same kind of risky behavior that I might otherwise under these circumstances, particularly if they draw my attention to it. I have a feeling that if you if you're swabbing everybody twice when they first arrive, you're setting up an expectation.
Yep. I think so.
If you're making people get their own balls, if you're forcing them to get their own towel,
God forbid,
their own banana or whatever, you're basically starting you're resetting some of the expectations that people have about sort of the culture of care and the culture of whatever.
Well, I mean, I cannot imagine in the middle of the U.S. Open finals that player gonna go run get their own ball.
Well, speaking of reset, though, because I want to draw your point to this, and I know time is coming, but you've talked about how sometimes in a response to a crisis, you set parameters that you can't unset.
Yeah.
I've been wondering about that.
So post-COVID, when we get there, does tennis look different? I mean, God forbid you always have to handle your own sweaty, disgusting, nasty towel.
But I think, people need to look at the list of rules that they're going to establish. And if you succeed in running a tournament that way, that means those ideas are on the table.
Right. And I think
you can't unring the bell.
I feel like that's true. I was, what I was thinking about Indian Wells actually, and how they had a norovirus outbreak or something like that.
Something like 2012 it was?
Yeah, it was something like 2012.
It was going through everybody.
Which is so gross. But I was thinking about how that it made it possible for them to go, yeah, I think we're going to cancel this.
Yep.
Because the last time we had something that was a little bit less serious, but really quite unsettling, we paid the price. Like everybody had diarrhea and they were all sick and tired. And so
then Miami felt it.
Right. Montezuma's revenge.
Miami will be pushing to be the first, and then Indian Wells would have to be second now.
Right. And so I would say that there were certain things we're willing to try, risks we're willing to take in other areas to basically reduce the possibility of harm or liability in the case of some of these tournaments. I mean, I think that Indian Wells' decision sounded like a little bit of both, right? They don't want to be liable for people getting sick at the tournament, but they also cared enough to say, yeah, like when all the ball boys and ball girls got sick, it was not good. And so, we don't, to some extent, I kind of want to say, because I think there's a good way and a bad way to read this parameter setting situation, which is to some extent what it might do is it might reorient how we think about caring for people under these circumstances beyond questions of liability.
Yep.
But to some extent, we're also, one of the things that has bothered me about this pandemic and the response to it is that a lot of the responsibility and accountability has been sort of devolved to the people themselves.
Yeah.
So we're supposed to have systems in place that facilitate or that allow us to be able to take care of ourselves or but also to seek care when we need it. And I'm worried, I was worried when we all had to stay home. I was like, so suddenly it's everybody for themselves. We're all hiding, we're all hiding from this virus. Like, it's not going to go away just because we're all hiding at home. There's a point at which people are just going to get sick and it's going to spread in our households, but we're expected to basically turn our homes into our offices, our homes into
gym
and our daycare center. Into our gym, as you see my bike in the background. And so all of these things we've been responsibilized. Everything's been privatized to our home. If we are lucky enough to have a home. And so, or the space in our home to actually conduct all of these activities that would be conducted elsewhere outside. And so these are the things that I worry about setting, the parameter being set and not being able to retract. Like, I don't want to have to be in my basement all the time, watching my kids and trying to teach my child alphabetical order. All of these things, I want to be able to live in a community, a functioning society where we are not afraid to be near each other. Wow. But yeah,
I think that was what Nole was thinking about when he had the Adria. So he was just like, I want to be with my bros. I want to be with my buddies. It was like too soon, right?
It was one approach.
One approach was
let's pretend. No, but one approach was like, let's pretend it's not happening.
Right.
Let's just hope for the best.
He could have actually had a distance target.
I know.
He really could have. There's so many ways he could have done that. He could have made people sit far apart. He could have had people watching it from outside.
It requires him to know science and be able to respect science. But he's all about my thoughts. I can look at a glass of water, positive energy, water bending, boom.
But miracle. Why did everyone buy? Other people had to buy into it, right?
But and other people did, and other people wanted to, right? Whatever that reason is, and I think they all have to explore that. Like as you said, the systems allowed it. Multiple systems allowed it, and then individuals decided, I'm going to buy in.
But the thing that bothers me the most is just I wouldn't follow Nole. If Federer had led this charge, I would have been like, okay. But I'm going to follow a man who's turning water into water molecules, turning it into some spiritual drink.
You know what?
Boo,
He is
turn
not
it into
following
wine.
anyone. You're not
Jesus
following
read
anyone
the
because you know
room.
what Rafa said? Rafa's like, I haven't thought about tennis. Like,
You know what I'm
like,
saying?
I have to say, like, this virus has revealed so many people, and I'm shocked because Rafa is such a competitor, and for him to be like, what tennis? What you want me to think about tennis right now? What? Like,
Rafa is secretly training. I don't believe that.
He's training, but the thing is, he's not pushing the tour out. Like, you know what I mean? Like it's like but it's necessary to say that. It's necessary. I mean, the thing that's strange to me is like the working poor tennis player is not the one aggressively pushing the tour out. It's people who have the capacity to actually be at home.
Right. And that was the other thing I was going to say. These are people who actually, they are fine. They don't need a tournament. So you're trying to figure out what is going on. Stay home. And in fact, when they were having the house parties in Chicago, they talked to this one woman who had, I guess she had been caught on Facebook Live and people were like, oh, she said, look, I've been staying at home every day with my kid for weeks and weeks and weeks. But all of these celebrities who are on their IG saying stay home and all this other stuff, they have basketball courts and tennis courts in their backyards.
I looked at their homes. I was looking in the background. I was just like, my home don't look like that. You need to shut up. I don't need to see you. I needed you to be in someone else's home because it was annoying. Right. Because they have look at that kitchen. They've never cooked a meal in that kitchen. It's a personal chef rolling up. They have a personal cleaner.
They have a restaurant refrigerator. They're doing push-ups on the counter.
Thank you.
Like, it's just like, you're looking at them and going, of course you can stay home. Why would you be like, let's go out and let's go play limbo in the clubs. let's hug each other and sign balls for babies. Like they really like,
it was the height of ego blown out to the most extreme.
And I would have
been like, take all that money you spent and put it in that pool and give it to those poor places that you didn't want to give any money to.
Two things piss me off is that they followed a dude who's talking about turning water into some magical thing by just looking at it, and not who could turn water into wine. That's the dude I'm going to follow. Okay? If he could say like, I could turn water into wine, that's what Jesus did. But the other thing is just like, he put on this arrogant tour just to basically say to the poor players, we can do this. And y'all should stop being out here. They refuse to actually have any assistance for the players who are struggling. They refused. He was taking about $30,000.
Small. I mean, this is the irony of it, right? Dominic Thiem, who was the most against it, rolling around, going from, he's still going from country to country, even though he's supposed to be isolating. Because even though he tested negative, he still was in contact with another person who was positive. So he should still be isolating. But he's like, I'm not isolating. I'm just going to keep testing and traveling. I was like, what's the purpose of that?
And hanging out with 65. They're having another.
There you go.
I do not.
It's very weird.
This is what I find. This is why I think it's so arrogant to put any sport tournament on. It's because people are going to defer to athletes to let them do whatever they want to do. No one is going to tell an athlete you cannot do this. And you shouldn't do this.
They need an education campaign, though.
Particularly when it's something physical.
But it's a little bit like what you said, Doctor. It's like, who's really informing them of the risk and really breaking it down for people? Maybe athletes have a really mistaken assumption about their own bodies. Everyone's kind of fearless. Maybe athletes think they're the most equipped bodies to.
Well, don't forget that at the beginning we kept hearing over and over and over again that if you're healthy, you're going to be all right. It's not going to be as bad for you. So true. They may also have been willing to take that risk, but hey,
information is new though. We know that that's not true, so they should.
Exactly. We do. I'm just like, I heard double lung collapsing. I'm just like, yeah, I'm gonna keep my ass at home because I know the doctor's gonna make a choice between when he see Realz and when he see Mr. Johnson. He might not. He's gonna let Realz. Okay, Realz, I'm gonna pull the plug on you. The ventilator. We gotta free up the ventilator. You know what I mean? I know that those were the reality that I faced if I were to get checked into the health system. I'm willing to take all the information for precaution because I don't know the cure will be there for me. You were saying, Andre?
No, I was just saying, so you said that you practice, coming to the end. How is the tennis practicing going?
It's great. Occasionally I think, oh, should I be sweating on this? You know, and what if I have it?
You're coming for Coco Crown, aren't you? You're going hard to Coco trade.
Yeah,
are you one of those? Are you one of those tennis players who amateur tennis players who think they miss the calling to be on tour? It's just like that, you know, like they're like, oh my God, like my backhand, you know, like I need to fix my backhand, and then WT's gonna call me up next week.
Not I. No, I'm a humble athlete in the sense that I know that I'm always going to be slow. I'm always going to be accident prone. But I
back of the court, right?
But I'm fit enough to play. You know, that's the thing.
Yeah, no.
That's sort of.
Are you watching? Are you watching tennis? I mean, do you actively miss it? I feel a little bit distracted from everything, so I can't quite take it all in, really. But are you missing it?
I thought I would be missing tennis more than I do. I thought I would be missing.
I want other people to admit that out loud.
But right,
I honestly.
I mean, it's hard when you're thinking about. I'm thinking about people and whether they're going to get sick, and so I kind of like. Yeah, like I've actually, so I'm saying I should say yes and no, because last week my kids did, in mommy camp, they had to do sports, and one of their sports was tennis, and they had to produce profiles of tennis players. And all of them were so cute with their Sloane Stephens and their Coco Gauff and their Serena or whatever. I hope you didn't hear that. And so we, you know, it was fun to do that. So we actually watched some old matches.
Oh, fun.
Wow.
And they, you know, they're kids, so it takes them a second. But it was kind of nice to watch old matches and go, yeah, that's why you have to bring your racket back a little bit faster or whatever. Early, you have to bring your racket back earlier. Yeah, that's why you actually have to, you know, put your hand up. I know we're all.
I have not missed live tennis because I can choose the matches that I want to watch and enjoy them knowing the results. And let me just say some matches, because you're right. I feel distracted if I am supposed to thinking like because to me, it's like my wanting live sports back, it's putting so many people at risk because athletes do not function within themselves. Athletes are used to someone else taking care of them. Especially top pro athletes, top pro athletes just got one priority: show up, be on time, and be in fit condition. That's it. Someone is bringing the clothes, someone is washing the clothes, someone is getting the skis, someone's getting the racket, the balls. Someone tell Nole what time someone asks Nole, what time do you want to be in practice tomorrow? And someone else make that happen. That's it. Right? Nole doesn't have to pick up a phone and say anything about I need to be here and facilitate getting balls to that court, right?
Right.
Those things are there for him. Listen to me. They're gonna hate this shit after the first week, particularly at the major, especially when our first exercise of this tournament will be at a major. Oh my God, they're gonna be revolting and they're gonna put other people at risk because they're gonna go hire somebody. You know, I'm gonna hire someone from Queens and just come here and I can vouch for this dude. You know what I mean? That's what they're gonna do. It's going to be a mess.
I mean, I don't know if we can have.
How are we gonna celebrate the U.S. Open in Queens? And Queens was so hard hit by COVID-19. How are we gonna do the first night match?
How's that so right. I mean, you're so right though. That's been the question all along. Is like when we start talking about essential work, right? Yep. Who it's not just about the consumer or the client, right? It's about everybody who makes things happen. It's about all of those people who are their essentialness becomes very clear.
And they're underpaid and they have the least access to medical care. Right. Because they don't even have the time to go there.
Nole's driver was positive. He tested positive.
Man, listen, these mofos are a hot mess. Well,
We always ask everyone who's on here, you know, what like who are your favorite players? We know you passed you passed the grand test, but like who's your top 5 men and top 5 women? They can be an old era, past era. It can be even you could even pick the players to be like, I would dump my husband for this player. That's all.
There aren't any of those. I mean, I have to say.
What?
I can say
you got lucky?
Right.
They're all
you win the husband lottery?
Well, that's a good point.
Okay. Sorry, too. You're bad. You're boo.
Oh no! I'm like I didn't prepare my list. Now I have to think about this.
I know. We'll get to next.
They're always floating around in your mind. No shame. No judgment.
I have to think.
We know we're not gonna say, but so that's one
list of players.
It doesn't have to be 5. It can just be some of the players who you don't mind watching. I'll think of it this way: who are the men and women that you don't mind watching some old matches off? I guess. And you can't say 2008 Wimbledon because that never happened.
My gosh, we have so many painful matches.
I know. I'm like, how do I even begin with this?
Although I have to ask you though, look, maybe this is, Federer fans have so many painful matches in their mind. Do you, as a Rafa fan, what's a painful match for you all? Gotta be some Nole match.
I know. All of them lately, right?
I'm gonna say every time he actually plays Nole.
I would think it would be that French Open loss.
Well, first of all, they have to spend they have to commit 6 hours of their day to a Nole.
It's a lot.
Rafa match, right? Like us Fed fans, we can check in whenever we want to. We can check in and check out conscience clear.
That's.
Those matches are long. They put you all through it. Raffalo matches want to make you something.
They're just crazy. Okay, so I definitely have Rafa in my list, though it took me a while to come around to his.
We understand.
I think it's just age. I think as they all age, I'm like, I mean, I used to really hate Federer, and then I was like, oh, okay, I can give him a chance now that he's old.
Oh man.
I kind of.
Sorry to the Fed fans who listen to us. He's a really smart and brilliant doctor.
I love Del Potro.
Oh.
Should I? Have I lost you?
It's not okay, but go on.
It's not okay. I love it.
It's not right. It's not right, but it's okay. That's what Whitney said. Sorry.
It's okay.
It's okay.
Love Ferrer.
Oh,
loved him. He's finally retired, right?
Yes.
I think I remember when he said he was retiring, and then I saw a match, and I was like, "Did you really retire?"
That happens a lot these days.
Somehow I thought COVID would have stopped him anyway. Even if he would have been like, "My body is too important to me. I'm gonna COVID."
He was, again, speaking of fit older guy, like he was fit until the end. Which I really
after smoking 6 packs of cigarettes a day, but
he was going to be a doctor, and he was like, "Oh no, I don't play tennis."
And on the women's side?
On the women's side, that's a little bit more difficult because there's so many really excellent players. Did I
just say all the black women? That covers a lot.
I did. I did.
Shade is the best shade.
I had to. Oh gosh. I'm really I actually am loving little Coco Gauff. I was watching her play with my kid, and I was like, oh, she's so sweet. And it makes me want to put my kid on the tennis court more.
Yes, all right.
I don't want to be that mom, I'll tell you that much.
I'm telling you, Coco is gonna ruin the WTA. She's gonna drag those girls out, and when she gets on that hot mic, they better pray she don't win, because when she has that trophy in her hand, she's gonna be like, "Look."
She's gonna be fists up, let's roll, and I'm gonna be right there cheering her on. Well, listen, thank you so much for joining us. It's been a lot of fun.
Thank you.
We really appreciate it. And next time you come on, you're welcome to come back on to just dish about tennis at any point. And you can get your list together. We will happily have you on. And I'm sure our listeners would.
Let's hope, right? Let's hope we can just have you come on and actually just be annoyed by a tennis match in a tennis tournament again.
great fun.
Yeah, so you don't have to bring work to fun to the fun time.
You got me before I could say Monica Seles.
Oh, we love Monica. We love Monica. We love Monica.
I love her. I still get mad.
Listen, you know what? She works hard to get over that because that could have really taken her down a different road because wow.
Yeah, the trauma is real, I have to say.
Yeah.
We love Monica. I hope I she's the one I want to come back on tour, not some of these people who I see like, let's bring this person running around. Like Monica is someone, I would love to see on the tour in some capacity, particularly
talking strategy, like listening to her call matches. She's not someone that they ever asked to really do that. That would be really great.
Yeah, you need to get rid of Martina, just saying. Oh, Dr. Benton, you have just earned the right to say you're a Rafa fan in my book by just that look.
Okay.
You've earned the right to say it's not right, but it's okay. We'll take it. Thank you so much for being with us. We appreciate it. So fans, don't forget you can subscribe button. We're here. The podcast will be available soon. And thank Dr. Benton. She's available on Twitter. I think it is at
Ethnography 911.
911.
Oh, and you know what? Next time around, we are going to actually really have you back to talk about this totally separate thing, the Atlanta child murders.
Oh.
Realz and I have been going back and forth about that for a while and just kind of unpacking that. And so I know that was something that you had kind of written about. And so I'm really, really excited to think and talk through that again as well.
Yeah.
Oh, so many things, so many great things.
So thank you once again. You are wonderful. And thank you for the work that you do because it's such important work. And particularly when it comes to looking at Black and brown bodies in a lot of these large and grand spaces. And my final word would be that to the general world at large, please understand philanthropy is not public policy. It's not a public.
Good night.
Okay? Philanthropy doesn't work. Cannot take the place of public health. Okay, we got to do the damn work. We just got to. Just think. Good night.
It's true.
Oh my